Hi, my name is Akash Patel. I'm one of the trauma and orthopaedic consultants working at the Royal Free London. Patients come to us with knee pain, and the first thing we have to consider is assessment. So what do we do? So the first thing we undertake is a history. So we ask the patient about the knee itself and the specific symptoms such as pain, swelling, locking, clicking, catching, giving way, how long that pain's been going on for, do they have any problems with other joints? We look at the hips, we look at the back as well, that can contribute to pain down to the knee. So after we've taken a history and assessed the patient's function and quality of life, we examine them. So we look at the knee, we feel the knee, we move the knee, and then we move forward with investigations. The most common investigation that we undertake is an X-ray, and this gives us a basic idea of the bone and the position of the joint. Sometimes we undertake additional tests such as MRI scans, blood tests, ultrasounds, or CT scans, but this is very specific depending upon what we think the potential problem is. So we have to undertake a full assessment first. So the key thing is obtaining a history, so finding about the pain, the swelling, what symptoms that they're causing patients, how the function is affected. Then we examine patients, so we look, we feel, we move the knee, and then we undertake a basic X-ray of the patient to look at the degree of wear and tear. Following this, we have a discussion with patients, and the key factors that help with the discussion and the decision making is obviously the degree of symptoms that the patients are having. So if patients are in severe pain with swelling and stiffness, they've tried all the non-operative treatments such as painkillers, physiotherapy, possibly injections, lifestyle modification, then we would consider going forward with total knee replacement surgery. So knee replacement involves removing all of the worn out cartilage and bone and putting in cement, metal and plastic. What it involves is patients having an assessment first, being seen also by our anesthetic colleagues. Usually patients come in and have an anesthetic which is either a general or a partial anesthetic called a spinal. We make a cut at the front of the knee, we remove all the worn out components and put in brand new components. There are risks involved as well, but these are small, such as bleeding, infection, swelling, stiffness, pain, and the patient is up and about walking straight away. After we do knee replacements, we suggest the patients start to mobilize with the same day or the day after. Patients are in hospital for 24 to 48 hours. After surgery, patients have physiotherapy, they have X-rays, they have blood tests, and the scars take about 2 weeks to heal. The overall recovery for knee replacements can take up to a year. The first 6 to 12 weeks, the knee is painful and swollen, but it gets better. And the important question after knee replacements is, why do we do them? So we do them to improve quality of life. If we look at all of the different types of operations that we do, knee replacements and hip replacements have got a very, very good quality of life. That's why we're undertaking more and more of these.